All right, I'll go ahead and get started. Hello, everyone. Thank you for joining us and welcome to this workshop on ableism and action. My name is Nancy Macpusau. I use she, her gender pronouns. I work at the Cross Cultural Center and am also a member of the Pan-Asian Staff Association. And today's workshop is part of our series, Equity Talks for Staff by Staff. I am looking forward to sharing this information with you and also learning what's on your mind in relation to this topic, especially as we talk about returning to campus eventually to return to work for some of us. That may bring up issues and matters of ability and challenges that may be evident or hidden challenges. And I look forward to hearing your insights and information about some of the things that are happening in current events as well. I'd like to begin with an acknowledgement and take a moment to recognize the unceded land and the original people of the Kumeyaay Nation, where UC San Diego campus is located. Now, many of us may not physically be on campus at the moment. However, we are still members of the UC San Diego campus community. Also, I'd like to recognize ongoing social injustices, including supporting actions needed to create structural, sustainable change. I should also say that there is a disclaimer. Closed captioning is on, and the captions may not accurately capture everything I say in real time, and I wanted to put that out there in case there might be errors. All right, to help set the tone, I'd like to go over community guidelines or values, and that includes encouraging you to stay engaged by active listening, being in the moment, being present. Also participating, there will be opportunities for you to share your comments, insights, or questions in the chat throughout the workshop. Mutual respect. Make space, take space is a reminder that we are creating an environment for others to express themselves, as well as encouraging you to take up space to voice your own thoughts and comments. There are times that we may need to lean into our discomfort, and that's where brave space comes in. And we acknowledge that we have different lived experiences, different levels of awareness, and sometimes we have to lean into that discomfort or learning edges to gain a deeper understanding of ourselves and also the interactions we have with folks. Next is an overview and outline of our learning outcomes for our time today, beginning with the social construction of disability, which is a discussion of institutionalized and conditioned perceptions of folks with disability. Secondly, we'll talk about socialization of persons with disability. That includes beliefs, depictions, portrayals, and messaging that we get from institutions such as the family, such as media, such as medical institutions, or conversations we have in the household. Next, we'll talk about levels of ableism within the context of individual, institutional, and cultural content. Historical legacies will include a brief discussion about the so-called ugly laws, practices of eugenics, sterilization, institutionalization, the medical model, and rehabilitation. And then towards the end, we'll talk about movements around ability, action, and then the very last part will be me asking for your feedback as I ask you to fill out the survey. So we'll go ahead and begin with this first question, and this is where you come in and share your comments in the chat. What are examples of everyday ableism? I'll give you a few moments to collect your thoughts, and I will do my best to keep up with the chat as necessary, put myself on mute, and give you some time to do that. All right, I'll read some of these out loud now. Still trying to learn what ableism is. Thank you for sharing that. Language such as lame in quotes, events without accommodations and lectures without captioning. Teresa shares stairs, high counters. Difficulty in access, thank you, Paula. Designing spaces for only a few body types, absolutely. Things blocking sidewalks, such as signage or vehicles. Thank you for that. Last minute meetings on the other side of campus, no notice with expectations for attendance. Thank you, Marla. Give it one more minute for any other folks who would like to add to the chat. Again, the question is, what are examples of everyday ableism? All right, I'll go ahead and continue from here. I don't see any more comments in the chat. Thank you all for sharing. I will go ahead and share a list of things. That's not a comprehensive list, of course, but to give you some ideas of ways to think about ableism in the everyday. That includes not accounting for participants needing accommodations. I saw a mention of that in the chat. That can include dietary needs, perhaps color blindness, and paying attention to how we present our slides. Folks might have low vision, maybe hard of hearing. There may be learning or communication styles that appeal to senses of touch, sight, audio, smell, or taste. Sometimes folks may have allergies to a certain scents or cologne, for example. Sometimes in Zoom meetings, there might be an expectation to have our video turned on, and that may not always be a feasible practice for folks for various reasons. That could be, maybe it has something to do with bandwidth, having to care for young children, nursing, maybe it's an unstable internet connection. Our workshop today will cover a broad description of ability, such as the examples I shared with you, and then also ability in terms of legislation or policies that have been enacted. Folks talked about high counters in the chat. We can talk about ability in terms of buildings or homes that have steps, but maybe there's no ramp, no elevators. Maybe the store aisles are too narrow for wheelchair access. Maybe there's no automated doors when we're trying to gain entry. People with disabilities are also underrepresented or misrepresented in society, in media, but also means the access to do things that are free of restrictions, free of threat. Sometimes, for example, going to rallies or marching in the streets may be seen as a privilege. And so ableism in that sense may not consider vulnerable community members due to safety concerns or security, affordability, or flexibility. Free from restrictions can also pertain to the ability to afford things, having access to networks, having access to social or cultural capital, or might have to do with health matters. So you don't want to compromise your health when you are needing to do things. And I wanted you to keep in mind this broader description of ableism as we move on. Here's a further description of ableism. It is based on privileged identities, access to resources, rights, a sense of belonging, institutional belonging and validation, that is. Some of us can enter the world and public spaces with a feeling that we belong, that a sense of belonging can be based on our interconnecting identities, including emotional, mental, physical, or psychological ability. Our appearance, age, class, gender identity, immigration status, religion, spirituality, sexual orientation, to name a few, can affect us feeling welcome, secure, or safe. Second point, discrimination and social prejudice against people with disabilities. Ableism is the belief that certain abilities are superior. Given the current pandemic and the practice of wearing masks, for example, for some folks could be a challenge. In addition to health issues, there have been reports, for example, of Black men expressing concern when wearing masks, especially homemade masks, the concern about being perceived as a threat, right, due to socialization of Black men and aggression. Also for Asian folks at UCSD for sure have reported feeling fear or concern about going out in public, especially with a rise of xenophobia and with Asian folks being blamed, right? So there's this culture of blame around the spread of the virus. And it doesn't help that we have labels like China virus or Kung flu virus that are circulating in media and around conversations. The third point is that ableism is rooted in the assumption that people with disabilities require fixing or repairing and defines people by their disability. In other words, this kind of attitude dismisses a holistic approach of one's personhood. And then the last point on this slide is that ableism classifies groups of people as being less than, inferior, that ableism includes harmful misconceptions and generalizations of people with disabilities. And such misconceptions can, of course, eventually lead to hostile acts. Since we are in a very critical time of campaigning and elections, I wanted to include this slide about the ability to vote. These are photos of voters in Maryland taken earlier this week. And on the bottom of the slide, there is the quote, "My people fought for the right to vote," which was and is a recurring sentiment or theme that Black voters expressed while waiting in these long lines and showing up to cast their vote. And these are unprecedented numbers that exceed the number of voters that turned out in the versus the 2016 election. So I'd like to go over a brief historical overview of voter suppression affecting African Americans in particular, beginning with 1868 and African Americans granted citizenship rights, yet still being limited from fully voting. This was part of the 14th Amendment, and of course did not always translate into the ability to vote. There were literacy tests, poll taxes, intimidation. There's also the grandfather clause enacted from 1895 to 1910 that provided that those who had enjoyed the right to vote prior to 1866 or 1867 and their lineal descendants would be exempt from recently passed educational, property, or tax requirements. The problem with this, however, was since former slaves had not been granted voting until the adoption of the 15th Amendment, just 2 years later, in 1870, this policy worked effectively to exclude Black people from voting, but assured the ability to many impoverished and illiterate white folks to vote. Then we have in 1965, the Voting Rights Act. What did that do? This was a policy that was passed by Lyndon B. Johnson with the intention to do away with racial discrimination at polling and voting sites, doing away with literacy tests, and also gave way for ballots to be printed in different languages. So what about today? What are some of the voter suppression acts that may be happening now? I'll go ahead and give you a few minutes to write any comments you have regarding this question in the chat. Does voter suppression still happen? All right, I'll go ahead and read what's in the chat. Transportation. Oops, scrolling down. Transportation challenges to voting sites, visual challenges to filling out voting card. Yes, thank you. Fake ballot drop boxes, discarding mail-in ballots for minor reasons unrelated to legitimacy. Thank you, Vanessa. Ebony says not letting folks who were formerly incarcerated vote. Yes, it's a very contentious issue. The Electoral College suppresses votes in more populous states, and returning citizens often are not able to vote. Thank you, Juliet. Voter ID laws in the state of Indiana. Yes, sometimes you'll see a sign at voting places. And again, we have the need of an ID to vote. Felon disenfranchisement, Shelby versus Holder decision, undermine Voting Rights Act, intimidation at polls, purging rolls. That was a scandal in Florida several years ago about purging rolls. Time off work, single parents, absolutely. Voting on a weekday. In Mexico, they do it on a weekend. Concern about the postal delays. Yes, it's a very hot topic. Lack of accommodations for disabled people at polls. Hey, thank you all for sharing that. This next video is a video of Judith Heumann, who is author and a disability rights advocate, and is author of the book called The Being Human. And in this interview with Trevor Noah, Judith Heumann discusses her lifelong advocacy for the rights of people with disabilities. And she also talks about the Netflix documentary Crip Camp, A Disability Revolution. This interview was broadcast in March 2020, shortly before we went into quarantine. And the trailer for the Netflix documentary Crip Camp, A Disability Revolution, was also released in March 2020. I'll go ahead and play this for you all.
Can I just say, reading this book, I expected to be impressed by it, but I wasn't quite expected for how much of a badass you would be. No, because you don't just advocate for human rights and rights for people with disabilities, but you fight for them, and you fight for them with a passion. Welcome to the show. Before I get into my first question, I guess what really blew my mind about your story is that I specifically have taken for granted so many things in life that I feel like were always there. Ramps, for getting into stores, ramps that help people get into buses when traveling, all measures that we put in place to help everybody be part of society. You lived in a world where that wasn't true, and you fought to make those changes. What was that world like before the world we live in today?
So I grew up in Brooklyn, all of you from Brooklyn, and at that time, so I was born in 1947. I had polio in 1949. There were no laws. There were no federal laws that made it illegal to discriminate against many people. Mm-hmm. Obviously, the Civil Rights Act in the U.S. didn't come about till 1964, and the disability community was not included in that. So my world was there were no motorized wheelchairs at that time because the technology wasn't there.
Right.
And so I lived in a neighborhood where there were small private homes, and I couldn't get across the street by myself because there was a step on either side.
Wow.
And still a problem today. Housing is not necessarily accessible. So you'll see in the book where I talk about going from my parents' house to my neighbor's house and having to scream into the house to ask my friend to come out and play. But as I got older, it became a bigger problem because the school in our neighborhood was not accessible. My mother took me to that school, PS 198. At that time, it wasn't accessible. After the laws came into being in 1981, it was renovated. The school became accessible. But the principal denied me entrance into the school because I couldn't walk, and he said I could be a fire hazard. But said not to worry because the Board of Education would send a teacher to my house, which they did for a total of 2.5 hours a week for the first, second, third, and half of the fourth grade. So I think you can see that the landscape has changed in many ways. Movie theaters weren't accessible. I went to a Chinese restaurant once with a group of friends in wheelchairs, and the manager told us we had to leave. And that's when I get really fired up. So there really is, I, it kind of comes out of me, and I thought, we're not leaving, but I can't just kind of say, we're not leaving. So I said, call the police. And the guy was like, and I said, we're not leaving, call the police. And of course, he didn't call the police.
Right.
And then we stayed there. But I think what's really important.
Yeah. It feels like that's been the story of your life, though, is defiantly, reminding people or even exposing to people how many obstacles so many people in our society face. As an able-bodied person, I take so many things for granted. We take things for granted.
I call you non-disabled.
You call me non-disabled? Oh, I never know which term it is, to be honest, because in the book.
I call you non-disabled because we also, because the likelihood of you acquiring a disability temporarily or permanently is statistically very high. So.
Did you just threaten me?
Yes, definitely.
We take for granted, though, either way, how little it changes our lives if we don't have disabilities versus how much of an impact it makes positively in other people's lives. Children can go to school, children can meet with friends and associates, people can go to work, people can live independently. You realize that there was a deficiency in America at that time, and there's still a lot of work to be done. The protests that you helped put together, though, was something no one had ever thought of before. We saw a little bit of it in that clip, but you decided to shut New York down, basically.
This is a very funny story. I have a lot of funny stories, but anyway. So President Nixon had vetoed the Rehabilitation Act, which has this important set of laws in it under Title V. And we had organized a demonstration in Manhattan outside a federal building. But because the buses weren't accessible and the trains weren't accessible, we weren't able to get anybody to go out and scope out this building.
Right.
Well, it turns out this building is probably the only building in the city where there's virtually no traffic around it. And we were having a demonstration, and we went and sat in the street, and nobody really cared because there were hardly any cars. And so, but the police were there, and they said, what would you like? And they wanted us to leave. And I said, well, where is Nixon headquarters? So the officer literally called in and said, where is Nixon headquarters? So we took the 50 of us, and we got over to Nixon headquarters. It was on Madison Avenue. It was completely unplanned. And so there we were, 50 of us,
right,
from Brooklyn and Queens and Manhattan and the Bronx. And we decided, okay, we're gonna shut down the streets. And what you didn't show in the clip is Ann Capolo, who is a little bit more than 3 feet tall, who's talking about how there we were, sitting, like shutting off all of the Madison Avenue area.
right.
Then we pulled back because it was a little scary with all these trucks, pissed off about how we were shutting down the city. But nonetheless, we were able to do it. But what I think is really important about my story is that my story isn't my story. So my story is really the story of many other people.
Mm-hmm.
And Kristen Joyner, who helped me write this book, because it wouldn't have come to being without her. Friends of mine with disabilities living in different parts of the world are also talking about how this is their story. Because the issue of discrimination and oppression and how our lives have been limited and how people are really gaining back our voices. And I think one of the important parts of the film Crip Camp that people will see is a camp where disabled kids went together, and how, you know, we went to a camp and we had fun, but we also really use it as an opportunity to be together, because in so many ways disabled people are isolated from each other. And so the camp really allowed us to begin to fantasize what we wanted the world to look like, and then also began to question why things weren't happening. And I think that really has been the crux of what's gone on in the United States and South Africa and countries around the world,
Right.
where people have finally said, we are not going to tolerate this anymore.
It's been 30 years now since the American Disabilities Act was passed. Many would feel like everything has been done and everyone has access to what they need. What do you still feel needs to be improved specifically in the United States?
So I think the United States and around the world, one of the big issues is that people with disabilities need to feel proud of who we are. We need not to be ashamed of who we are. Many people with disabilities have invisible disabilities like epilepsy or diabetes or depression or anxiety or whatever the disability may be. And people are frequently afraid of speaking out because of the stigma. And what we find when we start speaking up about who we are with pride and really ownership that we have a right to be equal members of our society wherever we live, that really makes a change. So I would say that the law is great, needs more implementation, more technical assistance. There are other provisions of laws that we need to have, but fundamentally, we as disabled people and as allies, like I know you are, because you've done some great work on your program, mental health piece that you did was fantastic. That's really, I think, what the objective is, that we as disabled people need to band together, speak out against oppression or discrimination against anyone, and that needs to be the norm. And I want to just also say, you know, I live in DC, and the metro there, some of the most frequent users of the elevators are men and women who have babies in baby carriages. So I think we really need to also look at the kinds of accommodations that theoretically have been made for disabled people actually benefit so many other people.
All right.
And people don't even realize why they're there.
That's really beautiful. I honestly, I loved every part of your story because of how fierce it is, because of how funny it is, because of how interesting it is, because of how much you learn. I mean, I learned about stories in and around the Disabilities Act, the story of America, and I learned that there was once a time in New York when there was no traffic on some streets. So thank you so much for being on the show. I appreciate you so much for being here. Being Human, a beautiful tale from real life is available now. And Netflix will feature Crip Camp beginning March 25th. Judith Human, everybody.
All right, there was a comment in the chat about closed captioning. We can correct for the closed captioning for the video when we load this into YouTube. Thank you for mentioning that. So I'd like to go ahead and share some takeaways from Judith Human and this interview with Trevor Noah. Judith Human had mentioned that there were no federal laws. Judith could not cross the street alone, that the burden was placed on the individual. There were no curb cutouts, no motorized wheelchairs. School was inaccessible for Judith. There were 2.5 hours of instruction that went to learning at home. And Judith was considered, as you've learned from the video, a fire hazard because of the inability to walk. She also mentioned that movie theater was inaccessible. You heard Judith's story about being in the Chinese restaurant and told to leave because of the presence of wheelchairs. And I appreciate that she also mentioned that Trevor Noah that there's a likelihood of acquiring temporary or permanent disability, which is statistically high, when she was talking to Trevor Noah. So going by what Judith Human mentioned in the last video, we're going to talk about the social justice focus in relation to looking at ability or looking at disability. Social justice framework focuses on one's interaction with the social environment rather than the body itself. So the focus is shifted to a deficiency in the environment versus seeing the individual as deficient. In other words, the system is disabled. Disability happens when designs in the environment fail to account for the participation of people with differing abilities. Social factors may lead to injury and/or illness. So the way environment structures are designed may be deficient for persons with non-typical physical, emotional, intellectual, or social abilities. Social factors like poverty, technology, can also contribute to the construct of disability. So when we're talking about poverty, for example, impoverished folks are more likely to have workplace injuries. There is an increased risk of chronic illness like diabetes, access to quality health care, limited accommodations and benefits. Poverty can also create disability. Disability can lead to poverty, job discrimination, transportation, and housing. And when we're talking about technology, technology can determine whether one's condition is a disability or a limitation that can be worked around. Corrective lenses, for example. We usually might think of devices that assist, like wheelchairs or voice synthesizers. Technology can include everyday items such as eyeglasses or having computers with adjustable zoom. The ability to afford technology can also be disabling. And when we're talking about definitions and expectations of disability, there are laws that protect only based on quote unquote proven disabilities. And sometimes there's a critique of ADA, Americans with Disability Act, that there is an impairment and that sometimes a definition of disability is an impairment that substantially limits major life activities. And so equating one's value with their ability to contribute economically is also ableist. So I'd like for you to reflect on this next question. Think about early memories or messages that you received about disability or persons with disability. I'll go ahead and give you a few moments to, again, collect your thoughts and share your comments in the chat. Okay, catching up with the chat, Judith Human was visiting UCSD pretty recently, October 13th. Oh, looks like the link is not working. So if there's another link, Sarita, that you can send to us, fantastic. So again, the reflection question is, describe early memories or some of the earlier messages you received about the notion of disability or persons with disability. Looks like there is a new link for Judith Human. Thank you for that. One of the responses to the reflection question is don't stare, don't look at them, adult scared. Adult scared me, I thought it was contagious. Yes, absolutely. My mother was a physical therapist who worked at an institution called the Home for Crippled Children. The kids she worked with were people I never saw outside that context. So there's a sense of isolation. My big sister had severe mental and physical disabilities, so I learned that physical disabilities were disabilities. I did not realize that my invisible disabilities counted. Yes, that's a common critique when we're talking about abilities or differing abilities. Attitude that disabled persons would need, quote, charity, unquote, so there was a lack of dignity. Thank you, Marla. Give it a few more moments. Beatriz says that disability was defined by very specific visible characteristics. Yes, that's true. That sometimes folks will characterize disability as having those physical limitations, and often we don't count for folks with hidden disabilities. All right, thank you for the comments in the chat. I will go ahead and move on to a video that's about the same length as the last video. It's about just under 8 minutes. And the title is Levels of Ableism. It talks about the pandemic and persons with disability. I'll go ahead and advance to that slide now.
For more than 60 million Americans with disabilities, the rapid spread of COVID-19 is particularly dangerous. Many live in long-term care facilities, which are at greater risk for coronavirus deaths. These Americans also are 2 times as likely to live in poverty as someone without a disability. But so far, legislation has fallen short for helping them. Stephanie Sy has a closer look at all of this, and we begin by hearing some voices of those affected.
I myself have a visual impairment.
I'm a wheelchair user.
I am also an advocate with Down syndrome.
I have a genetic physical disability called Larson syndrome.
I work in a day program. I'm the lead in the classroom.
We have been staying home for the past 2 weeks due to the COVID-19 shutdown.
I have a neurological disorder, and it confines me to a wheelchair, so over time I get a little bit weaker.
I have a 20-year-old daughter with intellectual and developmental disabilities, and this has been really hard on her and on all of us as her routine has just been flipped upside down.
I have a brother with autism. As a family member, my brother going into the hospital right now is our greatest fear. That is because we don't know the access that he would have to the services. We don't know how he would be communicated with or how he would be understood.
My biggest concern or fear doing this is healthcare, like big time, and medical harassment. Because believe it or not, many people with disabilities are not getting services right now.
My husband is my primary caregiver. If he were to get sick or called back to work before I have to go back to work, insurance will not allow me to get a home health aid that they'll cover because of the fact I work full time.
Shouldn't I love to be able to go to work and to get a paycheck, right? Yes. It is also a place where he can develop his artistic talents. It also gives him structure so that he does not have to spend the whole day staying at home. That is also very important for me, as that will give me a break from having to keep him busy the whole day.
As a blind person, when you step out, it's inevitable that you need assistance. We have the social distancing. We are talking about not touching each other, which is understandable. And on the other hand, you need help. You need somebody sometimes to hold your hand.
We're starting to see some challenging types of behaviors. We have a few new holes in our walls, and she sometimes just has uncontrollable sobbing during the day, which is heartbreaking for a parent.
My aides are not coming in on a regular basis as they would before, because they are either scared of getting me sick or scared of getting their family sick. I feel like I have taken a while to build my independence, but like I'm kind of going backwards.
There is a spectrum with essential workers, and the spectrum is we are at the bottom of the barrel. Like the doctors and the nurses and the fire department and the police department are so high up, and yes, they put their lives at risk, but so do we. We have people who make $12 an hour, and we don't have the proper PPE. People will stop you in the street and they'll say, God bless you, you have a place in heaven. What about my place here?
This is not a pandemic only problem. This is a systemic problem that occurs constantly, and we need to find a way to overcome these inequities in order to move forward and ensure that it's a more accessible world for everyone.
As you just heard, there are a cascade of challenges facing people with disabilities in this pandemic and facing the people that care for them. Joining me now for a broader discussion on all these issues is Rebecca Coakley. She is the director of the Disability Justice Initiative at the Center for American Progress. Rebecca, thank you so much for your time.
Thank you so much for having me.
We just heard a number of people talk about their loss of services. Can you talk specifically about what services have gone away and how critical they are for people with disabilities?
We're hearing stories from all over the country of people who've lost access to home and community-based services, to the people that come into their homes on a daily basis, help them bathe, help them eat, help them learn, help them actively engage in society. And because of the pandemic, whether it be their caregivers actually contracting the illness or working for organizations that are closing right now due to the illness, we're hearing stories from people who just can't engage in society anymore. They are worried about the loss of services actually forcing them to be institutionalized or put in a nursing home against their will. And nobody wants to be in a nursing home right now.
And so even as people lose those at-home services, they get thrust into a situation that could be more dangerous?
Definitely. Having the inability to prepare food for yourself, having the inability to roll yourself over at night in bed to prevent bed sores, which is one of the most critical issues facing a lot of people with disabilities in this country. Being unable to roll over in bed might be an inconvenience for a non-disabled person, but it's not going to kill you. For our folks, that sort of lack of access to services does mean serious injury and potentially death.
What happens when a person with a disability actually becomes sick with COVID-19? The Center for Public Integrity recently released a report that said at least 25 states have enacted policies that could mean that people with disabilities could fall to the back of the line if there is an overwhelming need, for example, for ventilators or other healthcare support.
This is not something new for us. Anytime there's any sort of healthcare rationing, it's the sad truth of history that we know that typically we're put to the end of the line. People do not value our lives. People don't look at disabled men and women and people as anything beyond sometimes being needy.
For people that don't know, Rebecca, what is healthcare rationing and what does that say to somebody with a disability?
When it comes to who gets priority of care, the hospital can actually, in some cases, have language that that lowers the priority for people with pre-existing conditions or other types of disabilities. And so can decide that the 24-year-old with Down syndrome's life is worth a lower level of quality of care or lower access to care than, you know, a 72-year-old or a 54-year-old.
That's got to be pretty painful for a person with a disability to have to confront.
Definitely. And that level of medicalized ableism is something that people with disabilities encounter on a daily basis anyways. That's the reality we live with as disabled people in this society, but that doesn't mean it's okay, and we shouldn't be okay with it.
Rebecca Coakley with the Center for American Progress. Thank you so much for your insights, Rebecca.
Thank you.
All right, some takeaways from the video include access to healthcare services and coverage from insurance, touching as a necessity, especially in this time of social distancing and limited touching between folks, But there's a hierarchy of essential workers and pay scale, equitable pay scale, systemic problem, and the fear and concerns over the loss of services at home. Levels of ableism also include systemic oppression that disadvantages persons with disabilities and favors folks who currently do not have disabilities at the individual, institutional, and cultural levels. So we'll begin with environmental structures. There are some structures, and I mentioned this earlier, that limits options: no ramp, seating, width of doors, no automatic doors. There may be accessible housing that's designated for senior citizens or could be found in newer constructions, which sometimes can lead to fewer options, leading to the need for paying more for transportation, masks for persons with respiratory matters. Here is a photo of a see-through mask for folks who are needing the ability to read lips. In education, those who have learning disabilities that make a learning style difficult for them might be perceived as less intelligent, might be required to get documentation to prove their need. The use of language and labels, such as casual insults used for people with intellectual disabilities, evoke images of incapability overall rather than treating folks as whole people. And then dismissive behaviors can include examples of taking up spaces, like parking reserved for folks with disabilities. Some of you had mentioned this in the chat: staring or avoidance of looking at persons with disabilities, talking to somebody's caretaker or aide versus directly to the person in question. I'll talk a little bit about historical legacies of ableism for the next few slides. We'll begin with the stigma and the so-called ugly laws. Ugly laws was a nickname given to policies that were often referred to as unsightly beggar ordinances. And this was in effect in the law books from 1867 to 1974. This is a policy that prohibited persons who were, quote, diseased, maimed, mutilated, or in any way deformed so as to be an unsightly or disgusting object, unquote. And this is taken from Chicago City Code, 1881. Chicago also happened to be the last place to repeal the law. And these ordinances were popular in places such as Chicago, Denver, Lincoln, Omaha, San Francisco, Reno, and Pennsylvania. Los Angeles and New York attempted to pass ordinances. They did not pass. Next, I'm going to talk about eugenics and sterilization in the US during the early 1900s. Eugenics comes from a root word meaning well-born. The rationale for this practice of sterilization was to eliminate genetic defects, undesirable traits and characteristics in order to create a so-called superior race linked to white supremacy that would be devoid of feeble-mindedness. Again, maimed individuals, blindness, hearing impairments, Blackness, by limiting the reproduction of perceived inferior people. California was actually the epicenter for quite a while of the eugenics practices, sterilizing mostly women. American scientists would send literature promoting sterilization procedures overseas. Institutionalization, 18th century to the 1960s, doctors convinced families that they could not care for loved ones and were then committed to asylums. Residents with disabilities were subjected to medical control, research experiments, and abuse without repercussions, such as electric shock therapy, lobotomy. And the idea or the perception was to protect society from communities with disabilities. I'm going to go ahead and move on to the next slide in the interest of time. Movements and action. We begin with independent living. The key goal of community-based services and support systems. This helped push the passage of Section 504 of the Rehabilitation Act that resulted in the changes in accommodations for transportation, communication, employment push for types of requirements for reasonable accommodation, and non-discrimination based on disability. ADA, known as the Americans with Disability Act, passed in 1990 by George H.W. Bush, is often underutilized. Folks sometimes are unaware of their rights. Sometimes ADA is most helpful to those with privilege. There has been critique about applying this policy uniformly, and it defines a qualified person with disability in terms of ability to perform the essential functions of a job. Universal design refers to ways that structures, products, programs, and services are constructed to facilitate differing abilities that also benefits persons currently with no disabilities. We can observe these practices of universal design in grocery stores, such as an automatic opening door, having motion sensors, lighting. It also benefits folks who use strollers, persons carrying a child, elderly folks pushing a cart. The drawbacks is that taking additional factors beyond the fiscal into account in education, there might be financial barriers or transportation costs. Last item on the slide is talking about allying. Allying in terms of challenging patterns of oppression, being able to name privileges, disrupting and dismantling structures, proposing legislation that facilitates access. That is the end of this presentation. Thank you all for participating. Please take a moment to write a comment and take our survey. There is a QR code that you may use here by using your phone, or you can also use the link on the bottom, tinyurl.com/CCCSJE survey. Equity Talks for Staff by Staff will have another upcoming program on Wednesday, November 18, for those of you who follow the weeks of the quarter, that is week 7. And the title of that talk is Afrofuturism, Reimagining Blackness as a Path Forward. The registration link is there as well. If you are interested in knowing what's happening in and around the Cross Cultural Center and also in the campus community centers, programs and services, you can also take a look at our link tree, which features information on Instagram, Facebook, instructions on how to sign up for our electronic newsletter, and then also features our YouTube channel at the Cross Cultural Center. I'm going to take a moment to look at the chat here. Thank you all for sharing. Take a moment to read this. Thank you, Laura, for sharing that. And I let you know that we will probably edit this video and post it on our YouTube channel at the Cross Cultural Center. Another message coming in the chat. Thank you, Laura. Thank you, Sarita. I'll stay in for a couple more minutes. Thank you all for participating.